Okay, so hello and welcome everyone once again. My name is Kemi Akagu, and I'm one of the Springboard community managers. Today's webinar is brought to you by Springboard, an online platform under the Breakthrough Action project. Breakthrough Action is USAID's flagship program on social and behavior change, and the project accelerates the use of social and behavior change through evidence-based tools and processes that encourage the adoption of healthy behaviors while addressing structural barriers and underlying social and gender norms that prevent uptake of services and positive health behaviors. Welcome again. And if this is your first Springboard webinar, a bit about Springboard. Next slide. So Springboard is an online community of over 4,000 social and behavior change professionals from over 100 countries. Springboard provides a platform for SBC professionals to share ideas and learn from each other. Next slide. Springboard can help you build your SBC capacity, connect with colleagues and SBC leaders, and get inspired through resources, events, and jobs. If you are not yet a Springboard member, please join today. And you can join by the link shown on the slideshow. So thank you and welcome again. Feel free to use the chat feature to introduce yourself. Let us know who you are, your organization, and where in the world you're joining us from. We're very happy and eager to meet you. So today's webinar is the first of a two-part series in which we'll be exploring how SBC programs can utilize data from digital platforms to inform their design and implementation. And today we would have two presenters, and that will be followed by a Q&A session. So without further delays, we'll go over into the presentations. And our first presenter is Saifra Sohail, and she's joining us from Johns Hopkins Center for Communications Program, where she's a monitoring and evaluation officer. Over to you, Saifra, and thank you so much.
Thank you so much. Good morning, good afternoon, good evening, maybe to some of you. It's nice to be here on with everyone. So today I'll be talking about how social media data can be used to inform social and behavior change programs. And so let's just set the stage a little bit. On the next slide, please. Let's talk about digital data and the increased use that we've seen over the past few years, especially since the pandemic. You know, we've really seen that people are spending more and more time on digital technologies. I'm sure we can all speak from personal experience as well. You know, this includes our smartphones, our tablets, our computers, laptops, just to give an example. We're also seeing an increase in smartphone ownership and internet use among adults around the world. And it's been estimated that more than 5 billion people have mobile devices, and over half of those connections are smartphones. And so data from different digital platforms such as social media, SMS or IVR, or just different apps are increasingly being used for public health research for near real-time remote monitoring of public health outcomes. And they're also being used for public health programs to disseminate important content on different health topics. So on the next slide, I'll be talking today primarily about social media and how we can use social media for SBC programs. I know most of us are familiar with the term social media, but just to give a definition, it's really any application or website that allows users to connect in a virtual community or network, and it facilitates an unprecedented reach, frequency, usability, immediacy, and performance of shared information or content. So by this definition and our common knowledge, we're all familiar with a lot of different social media platforms such as Facebook, Instagram, Twitter, YouTube, LinkedIn. There's many others as well, which I haven't listed here, but this should kind of set a definition of what I'm referring to when I speak about social media. On the next slide, please. So social media for social and behavior change programs. Specifically, when it comes to social and behavior change programs, there's several ways that we commonly see social media being used. And the most common scenario, the most common use case scenario is disseminating content or engaging with individuals on social media platforms to promote specific digital behaviors, specific health behaviors, beliefs, norms, or knowledge on different health-related topics. And so an example of this would be a Facebook campaign with a Ministry of Health to promote getting the COVID-19 vaccine and addressing misinformation and rumors around the vaccine. So, these are just examples that, I've made up for the sake of, describing what these use case scenarios talk about. We will talk about actual real life examples moving forward. Another example could be a campaign using influencers. So, people who have a large following on a social media platform usually are focused on a very specific or niche topic, and using their platform or their accounts to encourage a target audience to register for a webinar or related to a specific topic. And so that registration for the webinar could be seen as a digital behavior that's being promoted. That's one of the most common use case scenarios we see, doing these social media campaigns, engaging with people, and disseminating content. Another use case scenario that we see in SBC programs is social media platform or website being used to create an online community. And so actually Springboard is a really great example of a website doing that. It's an online community for our SBC professionals. And another example might be a Facebook group that's created for family planning providers from a specific region of a country, sharing information and resources with each other within that private Facebook group. And a third common example of how social media is being used among SBC programs is social listening. So this can be done in person, with community groups on the ground, but is now increasingly being done online using social media platforms and data. And so an example would be, listening to online conversations that are happening on social media for users who are based in the Philippines talking about rabies. So that's just an example of how, social media is being used for different social and behavior change programs. So on the next slide, what I'm going to do now is talk about some specific examples from a pilot that was conducted under Breakthrough Action using social media that can highlight how social media data can be used to inform SBC data. To SBC programs, I'm sorry. So this was a pilot to use social media software under Breakthrough Action for us to apply some digital innovation to our ongoing COVID-19 social media activities. And we implemented the use of the social media software with both social media management and monitoring tools, and as well as social listening tools at an enterprise level among a select group of Breakthrough Action projects that were working on COVID. And there were primarily two types of activities related to social media that these projects selected for the pilot were doing. So they were either working on social media campaigns or they were involved in social listening activities. So on the next slide, by social media campaigns, again, I'm referring to projects that have developed full social media strategies to disseminate content. They had created these strategies to disseminate content related to COVID-19. A lot of the projects were using their own project's Facebook page, or they were using the Ministry of Health in their country's social media accounts, or alternatively, they had given content to influencers and had them posting content to their pages. So there were several projects who had these campaigns going on as we began the pilot, or they were just starting up. So we provided them access to the appropriate tools and dashboards after getting them set up in the software. And so what type of data is available through social media SBC campaigns? So there is access to social media metrics. So those can be used to monitor the social media strategy, adapt the goals of the activity as needed, and modify the content that's being disseminated or posted as well. And in reviewing this type of social media data, it's really essential to understand what each metric is telling us and how to use that information within the context of the campaign. So on the next slide, I'll give an example of a specific social media campaign. The Breakthrough Action Cameroon team had an influencer campaign set up to disseminate COVID-19 messages. So they had a specific hashtag being used with each post that an influencer based out of Cameroon was sharing. And so using this hashtag and the influencer's profile link, we were able to create a monitoring dashboard within our software. And then we were able to look at the social media data for the specific posts for those campaigns. And so the social media data from the influencer monitoring dashboards allowed the team to explore different questions such as, is this audience being exposed to messages as planned? What time of day and day of the week was the audience most active? What influencer had the highest engagement with the audience? And are there any new opportunities to reach the intended audience? And these questions were being addressed with the data, but then prompted further questions and were allowing really for an opportunity to learn more and then come back and adapt their social media strategy as needed. This is just an example of some high level questions that were being asked. And this was a brief campaign for, I think it was about a month only. But again, depending on the level of access that you have to a social media account, that will also range on how much data you can access about your social media content and how in-depth of questions you can be asking using that data. So that's just one example of how social media campaigns can provide social media data and then inform the SBC campaign that's being conducted on the social media platforms. On the next slide, I'll talk about a different use case scenario, which was social listening. So we also used the social listening tool within the software for the projects that were included in this pilot. And these projects were generally listening to online conversations related to COVID-19, primarily to identify misinformation and rumors. And the type of data that's available from social listening software using social media data is very specifically public content. So it's public posts and content from social media platforms, websites, or news sources filtered by the location of the users or account. And then when you use a social listening software, you're adding a specific query to filter down to the conversation that you want to listen into. So the data is filtered by that specific query, the keywords and terms. And it's important to emphasize, that this is only providing you with public data. There are some limitations when it comes to social listening using social media data, but I think that's just the nature of the way these social media platforms such as Meta and Twitter have set up, to protect the privacy of their users. So I think that's something always important to keep in mind. And so the data that's available through social listening can be used for sentiment analysis, identification of common themes. So that includes those misinformation and rumors, or depending on the software you're using, you can also do audience analysis of those people who are having those conversations as well. So how the teams use this information varied. Some projects use this team to support their formative research. Other projects were using this to support rumor tracking briefs that were being shared with partners. So again, the use of the social media data varies, but many projects have found this to be very useful. On the next slide, I'll talk about a specific example again from our pilot, and this was Breakthrough Action Rwanda. So they set up a specific query to look at conversations related to the COVID-19 vaccination. And again, by keyword, I mean a set of keywords to filter through the public social media conversations and data that were available. So we were able to set up a social listening dashboard through the software, which provided a range of insights, including conversations that included misinformation and rumors related to the pediatric COVID-19 vaccine, as well as a summary of sentiment of online posts related to the vaccine rollout and COVID-19. And so the team used this information to share with partners as well as complement the other methods of formative research that they were conducting. So moving on to the last slide, hopefully these two examples and just this, this information has provided a good picture of how social media data can be used to inform your SBC program. One thing I would like to highlight that we did learn from the pilot as well as social media software as well as that social media software can provide deeper data insights than using the native platform or raw data. However, using that social media software does usually require a larger budget and tends to work better for larger projects that have a longer time period rather than a smaller project with a limited budget. And just a few other points to summarize that it's essential for us, I think, to work on translating, the social media metrics within the context of SBC activities. So, this means just going beyond basic reach and impression data that we're able to get. We can't just take the definition of these metrics at face value. Yes, reach means the number of unique people who have seen a post since it went live, but it's also going to tell us that what content of an audience what content your audience is finding valuable, as well as what time an audience is online. So it's really important for us to take these metrics and think about them in a little bit deeper context and how to apply them in the best way for our SBC programs. And all of this just to say, while it is essential that these SBC-focused digital activities should be linked to other SBC approaches to give a complete picture of what is going on, especially in countries where growth in digital and mobile technology have not been equal. Obviously, when you're working on a project, your target audience, your target, location of area that you want to be reaching. And it can be that those conversations are not happening online because there is no access to social media or mobile technology. So it's just always important to keep in mind that you might just be getting a part of that conversation. And it's essential to look at the social media data with other SBC approaches as well. But as technology advances and we are reaching more and more people around the globe, this will mean there will continue to be new ways to reach people and communities and more data for us to explore how to use. So things are constantly changing in the social media world. There's new platforms. I'm sure some of you have heard of Threads that just started by Meta. There's also changes happening within platforms. So Twitter turned into X. There's no more access to their free API. So it's important for us as SBC professionals to continue learning and explore not just social media, but all new digital platforms and really think through how to apply and utilize these within our SBC programs. So thank you so much. And I'll hand it back to you, Kemi.
Sorry. Thank you so much, Saifra, for sharing with us. And we'll move on to the next presenter. We have Victor Enangama, who is joining us from Breakthrough Action Nigeria, where he's Senior Program Officer, RCCE. Over to you, Victor, and thank you so much.
All right, thanks, Kemi. And good morning, good afternoon, good evening to everyone, depending on your time zone. All right, so we basically be talking around the experience and learning using geospatial mapping for targeted COVID-19 vaccination campaign. And for us, Breakthrough Action Nigeria, like Kemi already introduced, using social behavior change to increase practice of health behaviors around the thematic health areas listed all of here around family planning, maternal born childhood issues, and nutrition, malaria, tuberculosis, zoonotic diseases, and of course on COVID-19. We also try to show the map on the regions where we work in Nigeria, where we implement all of these programs. Can we next slide? And so we use the overarching risk communication and community engagement approaches to mitigate the impacts of COVID-19 through a design SBC intervention to address the needs of the general population and prioritize groups, basically trying to address the vaccine hesitancy and to also increase the vaccines uptake, and also to increase the COVID-19 testing among the symptomatics or exposed person, and of course, increase the practice of public health and social measures through also improving the social service communications to general populations. Next slide, Kemi. And so our program approach is basically choosing a systematic theory and data-driven approach to coordinate and collaborate with partners and government stakeholders. And I was very strong in grounded theories, using formative assessment to understand the factors influencing behavior. And so we are also able to apply insights from the theory of formative assessment to have a deeper understandings of the general population and why they are hesitant towards COVID-19 vaccine. And we'll also be able to build and leverage on new and existing structures. These structures that we're also able to use in engaging general population in the various localities. Targeted audience and segmented audience will also reach using this general population, using these various structures that we already have on ground. And of course, we have the channels of communication that were also able to motivate and change individuals. And of course, we also do the routine monitoring for adaptation. And so next time we're talking about the geospatial data for how we use it to guide implementation approaches to increase COVID-19 vaccination in Nigeria. And so here we're able to look at the guiding models, the 3C models, and how we also be able to address these vaccine hesitancy models. And so first for us, we had the confidence, we had confidence barrier, we also have the complacency barrier and the convenience barrier. And here we're asking questions, how these additional models are also able to influence people's behavior towards the uptake of COVID-19 vaccine. So in confidence, we're basically saying how does people generally believe that the vaccine is safe? How does the safety of the vaccine influence the behavior of the people towards the uptake of the vaccine? People actually feel the vaccine is actually quite effective, and how does the effectiveness of the vaccine in turn, influence the behavior towards the uptake of this vaccine? And of course, do the people actually trust the policymakers around the policy they've enacted around COVID-19 vaccines, and how do people see that, and how do they trust them to the point that they're able to actually use the vaccines themselves? The next group of vaccines is the complacency, and we are basically saying in here that the risks from contracting COVID-19, which is high, there's likelihood that people are able to actually take up the vaccines. But if the risk is quite low and the perceived is quite low, then basically people are tended not to actually take up the vaccine. Then the next group we currently have is the convenience, where people are basically saying if people are basically available, the vaccine are basically available, are there people willing to take up these vaccines? They also affordable. People within the space also able to access this vaccine within their own space. And if all of these are available, how are they also able to influence the uptake of COVID-19 vaccines among the general population? Next slide, Kim. So here, basically looking at the ideational model that we listed earlier on, how we're able to also use the snapshot of the audience segmentation to influence the uptake of COVID-19 vaccine. Remember, we talked about that the Johnson & Johnson model had different categories of segment of persons around COVID-19, and we had them around the confidence enthusiasts, pragmatic, vaccine ambivalence, vaccine skeptics, and the COVID-19 sickness. And our basic idea around was to see how we are able to reach the uptakers and the intenders for COVID-19 vaccine. Because we are strictly a data-driven SBC organization, we had a couple of data sets from the primary perception vaccine susceptibility surveys, other quantitative assessments, and of course the COVID-19 dashboard. We also had a whole lot of interplay within this data, which we actually use in making our informed decision around our programmatic decision programs in our set of implementation. So basically, we had a whole lot of data that we need to play around with to see how we are able to interact with this data that helped us make an informed decisions on how and where to reach out to this general population, and of course, define our SBC intervention model and messages. Next slide. Next slide, great. So why use the geospatial mapping data? Well, for us, the geospatial mapping data had the populated data on the demography, the settlements, and of person, of course, the media consumptions, and also the health facilities per location and per state in Nigeria. And so we leverage on this data because they actually had a spread of where the different segments of persons were basically located across the regions and states in Nigeria. The two utterly also demonstrated the synergy between the behavioral and infectious diseases by displaying a place-based information on vaccines attitude. And of course, this data was only pulled out using the geospatial machine method to create a local understanding of the vaccines uptake barriers across countries per kilometer. And that's a leverage on the 2018 Nigerian Demographic Health Survey and the vaccine acceptability studies of Johnson & Johnson that was conducted between August and September 2021. And of course, other data sources to plot and map the locations where all the various segments of persons were located across the regions and states in Nigeria. The dashboard also displays data on audience segmented, developed by Johnson & Johnson, and we have talked about this earlier on where we had the confident enthusiasts, the enthusiast pragmatic, vaccines ambivalent, vaccine skeptics, and of course, the vaccine cynics. And so we decided to use this platform to actually leverage and of course locate all of those, this category of persons and segments across the country. How we use the geospatial data to design the SBC approach, especially for targeted COVID-19 vaccination. The data actually gave us insight as to knowing why people aren't getting vaccinated. And of course, I talked about the 3C models earlier on, the convenience, the confidence, and the complacency. And we use the insights from the reports based on the WHO SAGE 3C models. We also wanted to know which population and segment are most resistant to COVID-19 vaccine. Remember, I talked about the enthusiast pragmatic earlier on, and so we had all of this segment, and so the data frame of the geospatial data actually provided us the platform to understanding which locations, which population and which segments are most resistant to COVID-19 vaccine. And so it also gave us the insight to understanding where the geographical location to actually focus on, and of course, what to say to change the attitude and these behaviors of these persons. That's basically because we have been able to, the platform gave us a platform of the segmentations, and so we are also able to look at what to say, why, where, which, where, and what to say to change attitude and behavior. And then the next, we also gave us the channels of communication on who should be the channel of communication to the people and to the targeted audience that we wanted to reach in our engagement. Give me next slide. So yeah, we were able to use the geospatial mapping data. I talked about my previous slide, we talked about how we use it to do our overall strategy development. But in here, we were also able to use the data to triangulate with the originally existing data per state, and that gave us insight as to the history of vaccination in that location, the population of the population of the people. Here we're basically doing a drill down, engaging the program officers to actually understand the context and how to apply the data that's available to us per state and per region. And so we also align the data with the national strategy of scale 3.0, targeting the locations with 35 to 40% of the vaccines uptakers per location. So after also doing that, we're also able to do some level of clustering of the communities with high uptakers that can access service delivery, and of course, how we're also able to work with partners who are able to provide these vaccines once demands are created. We also develop local specific content to address barriers and reduce hesitancy amongst this general population. So every state has their own specific context, but we needed to use the geospatial mapping data to actually engage these program officers to understand the terrain and of course know how to plot the locations, and then of course engage these persons properly well. So we also conducted community entries and advocacies, and they defined the structures and the key influencers for community engagement. Next slide. And so using data to inform and then, of course, structure all the things that need to happen at the regional level, Breakthrough Action Nigeria adopted a two-pronged implementation approach. basically response and strategy. And then, of course, because we were doing drill down engagement at the LG and the state level, we were also able to identify the unique segment and of course identify the unique channel through which to reach out to these various segments of persons that have been identified through Johnson & Johnson, and of course have been documented by geospatial mapping data. So we had the opticals also had intenders, and so of course for every unique group there were unique approaches that needed to have been adopted to reaching out for this person. So of course we applied these unique approaches with unique messages to reach out for these various groups that we identified, particularly the opticals and the intenders. Next slide. Which just this data tries to show where we were at November 2021 when we started the COVID-19 vaccination activities here in Nigeria, just to show that where the states where we implemented from Oyo State to Sokoto, and of course we see where the pointers list to shows us where we were, the numbers where we were before that period. And of course, come in, next slide. And so this shows where we are currently. We've been able to do our SBC intervention using the geospatial mapping to reach some states that attend 100% vaccination rates, states like Sokoto, Plateau. We also have Kano, where we have actually done some level of intervention. And of course, they'll be able to attain 100% vaccination rate because of the fact that we're able to apply the geospatial mapping data alongside the SBC approach to engage this general population. And of course, we are still working in some states to meet up this demand of having 100% vaccination rate in the states. Lessons learned using this geospatial mapping data, we're able to we had the ability to adopt the SBC messaging for the audience and in their location. In other words, we understand because we interacted, the geospatial mapping data was able to point to us where these persons were located. And so we were able to interact with them, understand their need, and of course, and we're also able to adopt SBC messages that suit the audience and in their location. We're also able to understand the drivers for the vaccine, for vaccination, for an audience. And of course, we also use the data to meet people where they were, using the community-driven change and a human-centered approach to engage general population and of course the segments of persons as identified by the geospatial data. The data also gave us insight to prioritize our resources and identify the most efficient intervention to use per location. You know, we had different segments of persons and their concerns were quite different. The concern of one group was quite different from the other. But of course, because we had this spread and we have the spatial data mapping, and so we're able to identify each group and of course, and prioritize them. Where we had the opticals, we're able to prioritize the group for us to target per time. And of course, we drill down that deep dive and of course, get those people using our resources within that space. We're also able to, the data also gave us insight on how to use support data tracking of the vaccinated person. So we already know, because the data has shown us to say per location, we had 5 to 10,000 opticals. And so for every activity that was drilled down per location, we're able to know the number of persons vaccinated and of course know what level of intervention will be required again to drive and also to get the remaining persons vaccinated. So of course, so we're able to drill down step by step using the different segments and different messages and different tailored approach to reach the various segments. And of course, the geospatial data actually provided that platform for us to use all of that. And I think that's my last slide, and thanks.
Thank you so much, Victor and Saifra, for sharing with us your experiences. And so we'll be going into a question and answer session. So for the audience participants, please, if there's any question you want to ask, feel free to still put in the chat while we're asking questions. So the first question, I'll direct it to Saifra, and it's about understanding the different types of social media software that can be used for SBC programs. I'm sure if anyone does a Google search, we'll come up with a plethora of programs, softwares, from different plethora of products from different organizations, companies, who all say that they're effective with social listening and getting insights into your audience. So are there particular softwares in your experience that perform better, or what should SBC programmers be looking out for in considering what software they should use? Thank you. Over.
Thank you for the question. Yeah, it really is going to vary, I think, on what exactly the project is doing. So like you said, there are so many softwares out there. There's so many different things that can be done, different tools. So it will really depend on what type of activity is being conducted. For dissemination and engaging with users, you really want to look for a social media management tool that will be something like Fiverr or Sprout Social, and really look and see, if it will meet the needs of your projects, because a lot of these social media softwares are really put together for company to do, their marketing work. That's traditionally what they've been used for. So I think it's really important to make sure you ask all the questions and learn about all the features and tools, and really think about how you can apply it to the work that you're doing as well. And same goes for social listening. There's a lot of different social listening software out there. And I think it's really important for SBC programs to really ask a lot of questions depending on who your target audience is, and really understanding what is the commonly used platform within your country. So, if Facebook is something that a lot of people in your country are using, that's where all the online conversations are going to be happening. There are commonly, we've found commonly that there are limitations when it comes to accessing Facebook data for social listening. So it's really important to make sure that you ask the questions of the software company that you're going to be using beforehand, rather than run into those issues afterwards. So again, there's a lot of different softwares out there. You can do a search, but especially for social listening, I think it's really important to make sure you know your audience and understand the use of social media within your target country or region before you select a platform. And when it comes to social media management and monitoring for dissemination of content, again, it'll be really important for you to know what accounts will you be disseminating those content on? Is it an influencer campaign? Will you need to be able to somehow monitor an account that you don't have owned access to? So there's a lot of different questions that go into this, and it's important to make sure that you have a good idea of your social media strategy or your social listening, research activity before you select that platform.
Okay, thank you, Saifra. So another question about social media. So we have this question: isn't social media usage skewed towards youth? Our sense is that youth is also the segment that gives the least amount of profile data or gives inaccurate information. So micro-targeting is tough. What do you think about that? Is social media skewed towards youth?
I think it will really. Oh, sorry. Go ahead.
Okay, yeah, and then how do you manage micro-targeting or micro-targeting your audience if information profiles are not complete or information is fake?
Yeah, this is a really good question. I think the social media usage being skewed towards youth, it will really depend. I don't think you can necessarily speak to every region or country. It will really depend on you doing an analysis of, who are the users online in the area that you're working in. And I think we can say, yeah, commonly there are youth online, but not necessarily. If you are targeting a specific audience, then it's important to look and see, okay, well, what platforms are they on? Are they using WhatsApp and LinkedIn? Maybe those are the places where you can reach the people. Youth might be on Instagram, not necessarily on Facebook. So again, I think it will really depend on what audience segment that you're focusing on and what is the common use in your country. Just reading the question again to see the comment.
Okay.
Yeah, it is a good option for listening to trends and rumors and fake information. But it is, I mean, that is a general limitation or challenge, is getting accurate profile information. And people actually, when you're looking at this data, and looking to understand more about your audience, really getting that information, it's only those people who have opted to put that information or make it available. So again, that is a limitation sometimes when you're doing online work, is that you only get data or information when you want to look at a specific audience or region, of even people who have selected their country, within their profile or their user account. So that can be a limitation. Yeah.
Okay. Yeah, so still speaking about limitations, since we've landed on that subject, are there other limitations you've run into using social media data for social listening? Both Saifra and Victor, you can also chime in if you have some thoughts or responses around that.
So thanks, Kemi. I think she's asking how was information about new rumors and misinformation quickly yet thoughtfully translated into government and partners' response on ground and through social media. So for us in Breakthrough Action Nigeria and the risk communication and community engagement, we had also run some level of social listening. And of course, we also had our community volunteers who were on ground, and they were picking some of these rumors and misinformation. And we're also able to immediately have a team that's also able to translate all of this, of course, into local. We had the partners and government working together with us. And so for every point in time, we're able to pull these new rumors and new misinformation. We're able to also develop content to address them immediately. And we also run a social media handles on Twitter, on Facebook, and of course on Instagram, where we dispel on a monthly or weekly basis these rumors that have been gathered from the field. We also have a very strong infodemics management system where we have all the partners and government members connected to that particular infodemic system. And so every rumor or misinformation that we pull up from the community, we properly analyze and of course content develop and then shared, and of course also dispelled through the community volunteers and community influencers, as well as the social media platforms.
Okay, thank you, Victor. Saifra, do you have anything to add about limitations using social media data for social listening?
Just to add on to, I think Victor just gave a really great response. I think he was responding to Carol's comment in the chat. So I just wanted to say, I think that's a really great way to share all the different ways that the information and rumors were being translated thoughtfully. And to come back to your question about limitations, I think just the biggest limitation we've run into is the limitations that have been set by the social media platforms themselves. And I think I touched on this a little briefly during my presentation. It's just the limitations that we're seeing. And then the fact that the social media environment is constantly changing. There are, just as an example, again, the changes with Twitter, I don't think anyone anticipated those changes happening when they did. So I think just the nature of things constantly changing, and things that you may have access to, you suddenly may not have access to. And so, yeah, just understanding that working with social media data, especially for social listening, can be a really, I think, dynamic environment and field. So yeah, Those are just some of the limitations that we've run into. It's just the constant changes that are taking place among these social media platforms.
Okay, thank you, Saifra. And Victor, okay, we have this question, and I think it was about, it's related to how vaccine uptakers were segmented. So the question is, how or where would normative or interpersonal factors be considered? For instance, subjective norms and descriptive norms could be barriers to vaccine uptake.
Thanks, Kemi. And I think the geospatial mapping had the behavioral attitude associated past segments. And so for us, we were also able to look at what the behavioral content segments were. And of course, we were ultimately able to develop content, or of course, to address these concerns as being highlighted by Johnson & Johnson in the data frame. But beyond that, our interaction also with these segments of persons as we go into the field and of course during the engagement, we are also able to get a whole lot of insights as around why people were not able to actually get vaccinated. For instance, in a region in Nigeria, the northern region in Nigeria, we actually got the wind of the fact that women were basically not coming out for vaccination because they really want to get their body exposed the general population when they're getting vaccination. And what we needed to do was to create a safe space where women were actually able to have have a privacy for themselves, and of course had the women to women engagement role, where we had the women, traditional women, the women in the community to actually engage in terms of mobilization. And of course, they were also able to have all of these their privacy issues addressed. And of course, we got a whole lot of general population of women from that region to be vaccinated, just to address the gender and social norms issues as regards to vaccination.
Okay, thank you so much, Victor. So we have a question. I think this is Victor. Oh, okay. Okay, sorry, it's not a question. Is Akiode giving some more insight into some of the barriers to vaccination? So giving some more insight into the program. Okay, so thank you, Victor. Thank you, Saifra. As we round up, do you have like any last thoughts or any last insights you want to share with the audience around using data from digital platforms for designing and implementing SBC programs? Anyone can go first. Thank you. Or perhaps, okay. I guess we've said it all basically. So thank you so much, Saifra and Victor, for sharing your experiences. Next slide. And as we come to the end of this webinar, like we mentioned at the beginning, this is actually a two-part webinar. And this particular webinar focused on using digital data from digital platforms. And the second part of this webinar series will be looking at the place of AI in SBC and looking at what it looks like in the present and future potential. And that will be taking place on September 21st, 9 to 10 a.m. ET or 1 to 2 p.m. GMT. So thank you, and we hope you'll be able to join us for that webinar as well. So until then, have a good day and see you soon. Thank you so much.
Thank you.
Thank you.
Bye.
Bye.
Thank you and bye.
Bye. Thank you.